On our journey to track down more MPHL game changers, we also had the privilege of interacting with Connie, the Assistant District Health Officer of Maternal and Child Health Tororo District. Her charisma is flawless and her passion for excellence knows no bounds.
I have a passion for mother and the baby. Tororo, I have hospitals, I supervise hospital, but Tororo General Hospital is high volume. And at one time we're experiencing a lot of maternal death. I got touched. I said, where is the problem? So I visited the hospital and I asked the MS to cause a meeting. We had a meeting and that time we said no. I think we agreed in that meeting, we started having monthly meetings. And that monthly meetings, we agreed on key points to make sure we reduce on the maternal death. Every month, I visit that hospital to see how many mothers did we lose, how many perinatal. So we had that chart. And that chart was a checking point for them. You know, when you lose a mother, you have to do that audit. At the beginning, I made sure I attend audits with them because there were also challenges on maternal audit. And that time maternal audit was like for only midwife. I said no. I had the MPDSR guideline, I brought it, I said let's look here. Do you see the number of people are supposed to be in the audit? MS, you are key. Administrators, you are key. Because decisions made here, you are the key people who should implement and take action on them, not these midwives. So we picked up, and now maternal and perinatal audit in the hospital is perfect.
With several leadership positions to her name, Connie is by far an MPHL game changer. Connie has been steadily promoted from serving as a senior nursing officer to serving at the district in the district health office. She is the Assistant District Health Officer of Maternal and Child Health, where she oversees the safe motherhood issues and influences policy regarding maternal and child health at the district and hospital.
DHO said no. The right person I need to hand over this office is my assistant MCH. When I heard it, I said, is it true? Sure, me? I said, I even went there, I said, but doctor, will I hand? I said, no. You have the potential, you have the capacity. I've looked around and you will manage. I give you the blessing. My knowledge I gained from ECU didn't go in vain. People look at me as a person who has the potential, the capacity. In church, I have a leadership role. I'm the health coordinator at the Diocese of Tororo.
With her network capital, Connie has been able to set up partnerships which have been of great importance to pregnant mothers in her district. Case in point is the strong partnership she secured with Save the Mothers East Africa and Uganda Christian University, which has seen to the installation of a high-dependency unit at Tororo Hospital.
You came and established for us a high-dependency unit we used not to have. You set it for us because of that collaboration we have had and we have continued to have. And in that unit, a number of mothers have been saved. At times we have challenges when a mother is there and they has to be pulled out because you have received a PET case. But you have to explain to them. You show to them, you see those machines? With the air condition, you are stable. But this patient, because at times they can have issues, say, brother and sister, how do we manage this? But we have now managed and we appreciate. But we are saying it is only one room. One room. How I wish you can add us another room so that we can have a bigger room.
In the words of Sister Doreen, a midwife at Tororo Hospital, the high-dependency unit has enabled them to reach a great milestone in their quest to save mothers. Sister Doreen and her colleagues have seen to it that every pregnant mother who needs to be monitored in the high-dependency unit receives the care she needs to save her life.
We also have the mothers who have sickle cell, non-sicklers, who need close monitoring. We also handle them in the HD unit. So with that, we have really handled a number of mothers in the HD unit. An average of 10 mothers. The lowest is 10 mothers in this HDU since the we established the HDU unit. Greatest is 23, 25. I think that is a month of around January, February. We have increasing numbers of mothers coming in with the preeclampsia.
A renowned journalist and former radio presenter, Jeremiah has cast away a life of luxury for a life of service. This step not only affected Jeremiah but his wife as well. Despite having stable jobs, their calling to serve was more important to them than anything else. The couple now humbly live in a village within the very community that they serve.
I used to work on TV and radio, and I was a radio presenter. And I would speak a lot about the news, the updates of the news early in the morning, what is happening in your community. And various people would call in to give me the updates on what has just happened in their communities. My wife was working in one of the 5-star hotels. She was very comfortable there. She never thought of maybe one day would come to a place where there is nothing, and she accepted my advice and also my sweet talking to her, how we can save maybe one mother, one child. She accepted, and we moved on to this community. We found nothing on this ground. A lot of banana plantation, trees and coffee, but we accepted to sit on this hill, which we have named the Golden Hill, and surely we have seen God's grace. It is transforming slowly by slowly. As the Golden Hill is transforming, community is also transforming.
After his research, Jeremiah made the decision to get on ground so that he could ably reflect on the challenges he had set his mind on. He has set up a school as well to curb the problem of illiteracy and also provide good affordable education for the community he now lives in.
I took the boldness to come and live now with the people, stay here with them, continue to understand them more, because sometimes research is a little bit biased. People, when they know you're from the university, they want to give you either the good side or extremely bad side. But I said, no, let me go back to that community, settle there, and I will observe, listen more what the community is made up of. And indeed, poverty, you cannot escape from of it. The high levels of illiteracy are still high. The poor roads, the nearest health facility is very far from reach. So indeed, I was able to come back here and started an organization called Mothers Heart Uganda. 2017, the Golden Hill Junior School started under a tree with one teacher and myself, and we had 82 children. At the moment as I speak, we have the kindergarten section and also primary 1 to primary 7. And now we have 18 staff that we are working with at the Golden Hill Junior School.
According to Jeremiah, the distant healthcare services are the biggest challenges mothers face. Because of this challenge, a dream of a maternal health facility took shape in his mind. He believes within a short time and with God's grace the facility will slowly take shape.
It was also one of the dreams that I had, that if we can have a center for maternal health within this community, and I'm lucky to tell you that we have successfully put up a strong foundation for the hospital, and I believe in a short time we shall be able to complete it, that people can break the long distance to the nearest health facility where they can access the maternal health care services. We are grateful what Save the Mothers has done to some of us. Like I speaking, it transformed my thinking that it's not all about the money, but it's also the will. You can penetrate and you can create a change in whatever you want to do, so long as you're determined. We have never changed from the time I graduated from classwork to research until today. I've never moved out of this community. I fight tooth and nail to see that the community is changed. I have experienced scenarios on this community. Almost every month, every week, people come running to knock on our door for support. There's a lady who had reached labor time, but she delayed to go to the hospital. She tried to deliver from home. Unfortunately, she couldn't. She overbled, and indeed they tried their level best, but one of the neighbors told them, no, go to Jeremiah, will save, has a car, and also the motorbike ambulance, they will save the mother. So what we did, we had to respond very fast. We went and picked her and took her to Mbale General Referral Hospital. She was attended to successfully. We saved the baby's life, and also we saved the mother's life. They are all healthy, and they are happy with us. The child has grown, is now 1.5 years. We are happy for that, and every time we see the child, we see happiness and we see a smile on our cheeks.
Reverend Moses was inspired to become a reverend after enrolling on the MPHL program in order to use the pulpit to spread the safe motherhood message to the faithful. His MPHL research on birth preparedness in the hard-to-reach communities of Elgon region enabled him to engage with teenage mothers who had given up on health services due to stigma.
I built a relationship between me and the church. And this is how we identified mothers from the church who were teenage mothers, who were neglected, who were isolated. In fact, they were even stigmatized under a name of like they are sinners. So in that name, they decided to shy away from accessing health services. But as we interacted with them at that time, they appreciated the approach we used because of the skills we acquired from Save the Mothers program.
In order to get his message across to a bigger audience of mothers, Reverend Moses has had the opportunity to use radio as a form of communication. This has enabled him to cast his net of wisdom in relation to maternal health to a wide and eager sea of mothers.
I've been even given an opportunity to speak on radio programming. One of the radios is Elgon FM. This is Mbale Bamasaba, meaning it is Elgon FM where Bamasaba should listen and hear the message. And specifically to share the message of hope, and this message of hope to bring to mothers that they have hope. And in this, we have built another relationship with a wider scope of mothers who listen to our program and come to seek guidance. But why I share this, it is because of Save the Mothers. One of the areas I want to mention is strategic communication. Mbale is in partnership with Words of Hope, radio programming. And Words of Hope, without boundaries, brings the good news. And one of the strategies they have given me, in a month at least I go once. That is Mbale Bamasawa. But again, with the Wise Choices for Life, they also take me once, meaning at least twice in a month. And in this, when we communicate, I think after every talk show, more than 20, let me say that, more than 20 people call back and give a feedback. Even after that, even after the talk show, again they call within or through the week, because we read our numbers. It is one of the mandate. When you go in that radio talk show, they say you have shared the message, but people will keep asking us, please tell them the number. This is one of the things we agree on.